Unit 1, Hospital Staff. Exercise 5, page 5.
Where do you need to go? Mercy Heart Hospital Directory. First floor, Robert Gibbons, receptionist. C4, visitor information, main lobby. Dr. Frank Fabrizio, radiologist. C4, X-rays, MRI scans, room 113. Lisa Kirby, lab technician. C4, analysis, test results, room 125. Susan Devlin, pharmacist. C4, prescription drug pickup, room 129. Second floor, Dr. Leslie Gupta, cardiologist. C4, heart disease, heart surgery, room 231. Dr. Terry David, pediatrician. C4, children's health, room 200. Third floor, Dr. James Lautner, anesthesiologist. C4, surgery pain relief and preparation, room 312. Dr. Stacy Walters, chief surgeon. C4, surgical procedures, room 323. Fourth floor, Dr. Jared Cho, general practitioner. C4, general medicine, room 403. Dr. Regina Beverly, obstetrician. C4, pregnancy, room 408.
Unit 2, Hospital Departments. Exercise 5, page 7.
Construction notice. St. Sebastian's Hospital wants to give its patients the best care possible. In order to do this, we need to update our facilities from time to time. As a result, we are starting some construction projects today. Some departments are temporarily moving during construction. The cardiology department is now in the basement across from the radiology and pathology departments. Obstetrics is on the second floor next to pediatrics. Access to other departments is limited. The entrance to orthopedics is now through the dermatology department. The surgery wing of the hospital is only accessible through the lobby elevators. The emergency room and the pharmacy are unaffected.
Unit 3, Rooms and Equipment. Exercise 5, page 9.
Longman Hospital, room checklist. Be sure that the following items are addressed before each patient is admitted. Sign and date after preparing the room. Check that a wheelchair is present. Test call button to ensure proper functioning. Make sure an oxygen tank is present and at least 80% full. Check that the alternating pressure mattress is working properly. Discard used hospital gowns and restock bedside table with new ones. Make sure drawers are stocked with latex gloves and gauze. Discard used syringes in Sharps container and restock drawer with new syringes. Empty and clean biohazard waste container. Room prepared by date.
Unit 4, The Body. Exercise 5, page 11.
Hospital Treatment Guide. Assessing new patients. 1. Approach the patient to assess the injury. Ask where the pain is. 2. Check for a pulse in unresponsive patients. Place your index and middle finger on the left wrist. 3. Look around the patient's body for external injuries. This includes swelling, bruises, and bleeding. 4. Feel around with your hands for bumps in the arms, legs, and extremities. Bumps suggest an internal injury like a broken bone. 5. Elevate the legs above the heart in cases of leg swelling or fainting. 6. Do not move patients with potential spinal injuries. Keep the patient's head in place. 7. Use first aid to treat any external injuries.
Unit 5, Parts of the Body 2. Exercise 5, page 13. Jefferson General Hospital. Patient name, Doug Robinson. Sex, male. Age, 27. Physician, Dr. Robert Moody. Time, 9:42. Incident or reason for ER admittance. Automobile accident. Apparent injuries. Head and neck. The patient suffered minor head trauma and may have a concussion. There is no visible injury to the neck. Torso. There are several small scratches on the chest and waist. I observed bruising on the abdomen and the rib cage. There is no damage to the legs or groin. Posterior torso. The patient complains of pain below the right shoulder blade. He also has a deep cut on the small of his back. Arms and legs. The patient's arms and legs appear in good condition.
Unit 6, the circulatory system. Exercise 5, page 15.
The circulatory system. The circulatory system pumps nutrients and oxygen around the body. Blood lacking oxygen enters the right atrium of the heart through the vena cava. The heart pumps this blood through a valve and into the right ventricle. It travels through pulmonary arteries to the lungs and receives oxygen. It travels back to the heart through pulmonary veins. The heart pumps the blood out through the aorta. It flows through capillaries in the body and delivers oxygen. The blood travels back through veins and the cycle repeats. But sometimes disruptions in the cycle occur. The heart may not pump blood effectively. This is called an arrhythmia.
Unit 7, the respiratory system. Exercise 5, page 17.
Smoking. Know the risks. Your respiratory system is important. The oxygen you need gets to the lungs through the bronchial tubes. Alveoli in the lungs give oxygen passage into the bloodstream. It also removes toxic carbon dioxide from your body. Smoking damages every part of this process. Smoking can lead to emphysema. This disease destroys alveoli. This impairs their function, makes breathing difficult, and raises carbon dioxide levels. Smoking may also cause lung cancer. The lungs' epithelial cells start growing uncontrollably. Smoking can hurt the people around you, too. Research suggests inhaling secondhand smoke is a leading cause of asthma. Asthma sufferers' bronchial tubes swell, making breathing difficult. Not smoking or quitting can decrease your chances of developing these diseases.
Unit 8, the digestive system. Exercise 5, page 19.
Patient, Virginia Hansen. Physician, James McEnroy, MD. Reason for visit. Virginia is complaining of sharp stomach pain and cramping. She is also experiencing occasional diarrhea. Examination notes. I find no evidence of throat or esophagus problems. I also do not think it is likely that the patient's discomfort is from an ulcer. It is possible the patient has appendicitis. The conducting of further tests is needed to narrow the possible causes of the patient's discomfort. Recommendations for treatment. I am recommending a colonoscopy to rule out any damage to the colon. This procedure is to include an inspection of both the small intestine and her large intestine as well.
Unit 9, physical assessment. Exercise 5, page 21.
Conducting a physical assessment. Below are instructions for conducting a physical exam. They detail how to collect subjective data and objective data from a patient. 1. Introduce yourself and obtain verbal consent to perform the exam. 2. Collect demographic data. This includes the age and sex of the patient. 3. Collect information about the patient's general appearance. Assess body build and affect. 4. Perform an inspection of skin, hair, and body. Check for any abnormal spots. 5. Perform palpation of skin and abdomen. Check for pain or tender areas. 6. Perform auscultation of the patient's heart and lungs. Check for any irregular sounds. 7. Perform percussion of the patient's abdomen and chest.
Unit 10. Recognizing symptoms. Exercise 5, page 23.
Cold or flu. Know the difference. It's flu season again. Knowing the difference between the flu and a cold saves lives. It's easy to get confused because a stuffy nose, sneezing, and sore throat are all symptoms of both diseases. Review the following conditions and symptoms to tell the difference. With colds, patients get moderate cases of coughs at the worst. With the flu, coughing can become quite severe. The flu also causes severe aches and fatigue. Strong headaches are a common flu symptom as well. In colds, these symptoms are usually mild. Colds rarely cause a high fever. In the flu, however, a high fever is one of the disease's main characteristics. Remember, early diagnosis of the flu saves lives.
Unit 11. Pain. Exercise 5, page 25.
Pain assessment sheet. Patient's name, Tom Rempel. Age, 34. Room, 17B. Physician, Dr. Daniel Newell. Nurse, Stacy Rose, RN. Please describe the location of the pain. Left knee area. What causes or increases the pain? Bending, squatting, walking. Please describe the intensity of the pain. For example, mild, moderate, excruciating, unbearable. Excruciating. Please describe the frequency of the pain. For example, occasional, intermittent, constant. Intermittent. Please describe the qualities of the pain. For example, sharp, shooting, burning, throbbing. Sharp. Please describe the impact of the pain. For example, crying, anger, distress, depression. Distress.
Unit 12. Medication. Exercise 5, page 27.
November 5th. Westbrook Hospital, patients and medication. Review today's list of patients and their medications. Administer the drugs at the stated times and check each patient off the list. Administered. Seth Banks, room 103. 1 dose of painkillers, 120 milligrams at 11 a.m. Frank Klein, room 101. Sedative 25 milligrams at 9 p.m. Kate Ford, room 114. Anti-inflammatory 125 milligrams twice a day at 8 a.m. and 4 p.m. Tim Hunt, room 102. Stimulants 75 milligrams at 3 p.m. daily. Ted Hurst, room 118. 2 doses of antihistamines 250 milligrams at 10 a.m. and 6 p.m. Erica Neal, room 120. Antibiotics 200 milligrams daily at 7 a.m. Ed Parson, room 105. Laxative 50 milligrams in the form of a suppository at 11 a.m. Jack Singer, room 100. Antidepressant 175 milligrams daily at 9 a.m.
Unit 13. Licensed Practical Nurse. Exercise 5, page 29.
Mercy Heart Hospital. Position available. Mercy Heart Hospital needs a talented and certified licensed practical nurse, LPN. This position requires both a degree and a license from an accredited school. LPNs are responsible for creating smooth and efficient patient flow. Along with helping doctors, they provide routine bedside care for our patients. This includes, but is not limited to, feeding patients, giving injections and vaccines, and checking for bed sores. They also collect and deliver samples for labs. LPNs are required to complete administrative tasks. Experience using and organizing electronic health records is vital. Additionally, LPNs complete weekly reorders for supplies. Send your resume to lucyronald@mercyheart.com to apply.
Unit 14, Registered Nurse. Exercise 5, page 31.
Trouble in the world of nursing. Chicago. Licensed nurses are in high demand across the country. Unfortunately, this shortage of nurses threatens the quality of patient care. Experts believe the biggest factor leading to this shortage is a lack of nursing degree programs. Some registered nurses get an associate's degree or a bachelor's degree, but such degree programs are rare. Others complete hospital-based diploma programs. These programs are too small, however, to train large numbers of nurses. Furthermore, after getting a degree, nurses take a difficult licensure exam, NCLEX-RN, from the State Board of Nursing. Finally, they have to follow their state's NPA, Nurse Practice Act. Such restrictions are preventing more nurses from entering the workforce.
Unit 15, Nurse Practitioner. Exercise 5, page 33.
Nurse practitioners and primary care. It's a familiar scene. Long waits at the doctor's office in crowded waiting rooms. But there's a way to avoid this and still get your checkup. How? See an NP, nurse practitioner, instead. NPs are an excellent point-of-entry health providers. They hold advanced degrees and must be board certified, so you're sure to get good care. NPs provide a wide range of services. They conduct physical exams and diagnose illnesses. They prescribe treatment such as physical therapy. Many provide regular immunizations for children. Some even offer counseling services. Though patients must see doctors for specialized care, nurse practitioners provide general health care without the wait.
AVN Pharma Education.